Hydrogen therapy has demonstrated potential in restoring the immune system of patients with advanced lung cancer. This conclusion is based on a scientific report published in 2020 with an official DOI number. The report stems from a scientific study investigating the relationship between oncology and the overall state of the immune system. The study involved 20 patients with advanced non-small cell lung cancer who underwent hydrogen therapy. The study concluded that hydrogen effectively contributes to immune system enhancement and has a positive impact on the overall condition of lung cancer patients. Hydrogen is an antioxidant gas that has been shown to penetrate lymphocytes and neutralize free radicals. Additionally, the cited report presents the first evidence that hydrogen inhalation can significantly improve the state of both the adaptive and innate immune systems. Immunosenescence is a process of biological aging associated with a progressive decline in systemic immunity, brought on by natural age advancement. It is also known that the overall immune system deteriorates with cancer progression, resulting in reduced levels of certain types of immune cells. This can be a cause for the recurrence of malignant tumors and their metastasis. Recurrent and metastatic malignant tumors are difficult to control due to three main reasons, one of which is immunosenescence. The other two reasons are the cancer therapy itself and certain tumor-related factors. All patients participating in the study received hydrogen inhalation for 4 hours daily for a period of 2 weeks. Prior to treatment, patients had low levels of immune cells from 6 cell subgroups that are crucial for the body's fight against cancer. After 2 weeks of hydrogen therapy, the levels of the diminished immune cells increased to normal ranges. The study's findings suggest the potential of hydrogen therapy to restore the immune system. Hydrogen inhalation can alter systemic immune suppression and thus reduce the invasiveness of lung tumors. Considering the disease and pulmonary symptoms of shortness of breath, cough, and chest pain that improved following hydrogen therapy, the researchers conducting the study argue that hydrogen treatment holds great promise for lung cancer patients. While research in the field of hydrogen therapy is still in its early stages, the results are highly promising. For more details on the benefits of hydrogen in the fight against lung and other types of cancer, visit one of the world's largest databases of scientific articles on the subject, published on our website hhofrance.com.